Deep beneath the bladder is a gland about the size of a walnut. It helps produce the fluid that carries sperm. But inside this small organ, a single damaged cell can begin copying itself incorrectly. At first, there may be no pain, no warning, no change you can feel. The abnormal cells may remain confined for years or develop the ability to invade tissue, enter the bloodstream, and spread to the bones. Today, we're taking a journey inside the prostate to see how this cancer develops, why some tumors stay quiet, and what you can do to reduce your risk and detect a dangerous disease earlier. The prostate sits just below the bladder and wraps around part of the urethra, the tube that carries urine out of the body. Its main job is to produce some of the fluid found in semen. Normally, its cells divide only when new ones are needed. Old or damaged cells are cleared away, and the tissue maintains a careful balance. Cancer begins when that balance is lost. Inside every single prostate cell is DNA, the instruction manual that controls growth, repair, and cell death. Over a lifetime, DNA alterations can build up. Some might be inherited, others develop from normal aging or cellular damage. When critical growth control genes are altered, a prostate cell can stop obeying the rules. It keeps dividing when it should stop. It ignores signals telling it to self-destruct. One abnormal cell becomes two, two become four, then thousands. Age is one of the strongest risk factors. A family history, certain inherited genes like BRCA2, and West African ancestry can also increase that risk. As these rogue cells multiply, they form a tumor. Many prostate cancers grow very slowly and may remain inside the gland for years without causing harm, but others are more aggressive. They lose the organized structure of normal tissue, they attract new blood vessels to feed their growth, and they release enzymes that help them break through into the surrounding area. If the cancer reaches the urethra, it might cause urinary symptoms, but early prostate cancer often has no symptoms at all. And since urinary trouble is often caused by a simple, non-cancerous enlargement of the prostate, symptoms alone can never diagnose cancer. The most dangerous change happens when cancer cells break away from the original tumor. They can enter the lymph vessels or the bloodstream. Most of these circulating cells won't survive the journey, but a few might reach another organ, attach to new tissue, and start growing all over again. Prostate cancer has a tendency to spread to the bones, but even when it's growing in the spine, the new tumor is still prostate cancer, not bone cancer, because the cells came from the prostate. So, can it be prevented? There's no guaranteed way. You can't change your age, your ancestry, or your inherited genes. But certain habits support your overall health and may help lower the risk of aggressive disease. Maintaining a healthy weight is key, as excess body fat can influence cancer progression. Regular exercise helps. Aim for at least 150 minutes of moderate activity a week. A plant-forward diet centered on vegetables, fruits, and whole grains can also be beneficial. And of course, don't smoke. Finally, it's vital to know your family history and discuss screening with a doctor. A PSA blood test can help find cancer early, but it can also find slow-growing cancers that may never cause harm. In the U.S., guidelines suggest that men ages 55 to 69 should make an individual decision about screening after talking with their clinician about the benefits and harms. For those at higher risk, that conversation might need to happen sooner. Screening must be personalized. Prostate cancer begins when damaged cells escape the systems designed to control them. Some tumors grow so slowly they may never be a threat. Others invade, spread, and become dangerous. That's why knowing your risk matters. Stay active, maintain a healthy weight, understand your family history, and talk with your doctor about when screening makes sense for you. Because prostate cancer may develop in silence, but an informed decision can reveal it before that silence becomes a danger.